basically, I congratulate you for hosting such an important and a very relevant congress. And this is very important. The topic, what you put in Bridging the Rare Summit, and the session today, looking ahead, building the bridges for the rare disease is very important. And as it's just the floor has been open to the amount of technology which is being developed, we just tell about the real case scenario in in India, how it stands and what we need to do. So we all know there are lots of rare disease definitions, and India, where basically is the WHO's definition of prevalence of one or less per thousand is being followed. And we know that many countries have different definitions, and mostly all these rare diseases has been led by parents and parent support groups, and that is how the globally all those non-governmental organizations are leading the front. In India, as a part of the rare disease policy, there is a central technical committee. There is a central technical committee which is there, and I'm a part of the central technical committee. And there are a lot of centers of excellence and Nidan Kendras which are there, and there are certain responsibilities for education training for all of them, and screening and diagnosis. And basically. Once again, I think this is just going as transition. There's a lot of, there is all of them have been, it's important for the diagnosis to take place. So that is why there are a lot of Nidan Kendras which are there for the diagnosis which is there. And at the center of excellence have to basically involve for the education, screening, diagnostics and prevention. And basically also a channel for giving the therapies which the government of India has approved up to 50 lakhs for any patient, because there are different kinds. There are three categories. One is the small, the small amount of money which is required for lifelong. Other is one time, like transplants and all. And number three is the really high dependency one, which is, although this 50 lakhs becomes less in the current scenario with the cost involved. We have a Center of Excellence and Advanced Research for Neurodevelopmental Disorders, in which we are trying to develop a national registry for childhood neurological and neurodevelopmental disorders. We collaborating, the Center of Excellence of ours is funded by Ministry of Health and Family Welfare and partially by India Infrastructure Finance Company Limited. And this was launched basically in 1st December 2017. And initially, we started developing around 15 registries, and I thought it was getting really confusing. Ultimately, what we have done is now we are making one consolidated registry with one master data form, because, most of these conditions have comorbidities. So it is very difficult, so in which registry and which will be the primary and which will be the comorbidities secondary. So that is why we thought of making one consolidated registry with one master data form. And then we have add-ons depending on comorbidities and also follow-up forms. So we are working in collaboration with Ghosh UCL. AIMS has a collaboration with UCL, and also with my my earlier student and now a colleague from CMC Vellore. So we three have been trying to put it forward, and I probably on 3rd of December we will be beginning the launch of this first step. And this will be important because we are covering so many conditions, and rare disease will be one among them. And we'll also be empowering the professionals in the LMICs to have the various, the data sets and data points which they are not using. And we'll have it at 2 tiers. One will be the basics which are mandatory, and the others will be the optional ones which can be used for research. This is in the 5 thrust areas of Center of Excellence. This first was which will be very much interest to most of the rare disease community. And second is also a National Knowledge Training Center, in which to train the pediatric neurologists, the pediatricians, and the allied professionals, and empowering the parents for various conditions. We do have a website for the same, and I'll just be showing some of the slides. And besides the website, in which you have print material, which is there in soft copies, and also videos, we also have training workshops. And third is the advanced diagnostics. And as regard the rare disease, we are trying to work with, over the last 5.5 years, we have been collecting data on epileptic encephalopathies and trying to understand which kind of epileptic encephalopathies are in the subcontinent, and also doing the non-Duchenne muscle dystrophies, the non-dystrophinopathy muscle dystrophies, and trying to understand. Besides, we're working on autism and others, but this would be the basically for the rare disease component. For advanced therapeutics and rehabilitation, we are working with technology to try to have artificial intelligence, virtual reality, augmented reality stuff, and neuromodulation coming up, like transcranial magnetic stimulation, brain-computer interface for all these conditions. And also, we established a tele-helpline and tele-consultation services on 13th April 2018. That was much before COVID was came up, because I felt most of these conditions last across the lifespan, and you need to provide support to the parents. And a helpline is for anybody to call anytime, but tele-consultation is for our own patients on follow-up. And we are, avoiding a face-to-face consultation and doing a telephonic structured consultation. And before doing that, it was important to understand that we are not missing a critical clinical event. So we had done some research on epilepsies and, other Duchenne muscle dystrophy and all, and try to do a follow-up and see that we are not missing critical clinical events. In the first set of studies, we had the pediatric neurology DM resident calling. And in the second set of studies, we were comparing the DM pediatric neurology resident and the pediatric neurology nurse calling. And that is why, because it turned out to be well, I had presented in American Academy of Neurology and Congress, and it was really well appreciated. It's now published. And then we took off this helpline on a regular basis with pediatric neurology nurses manning round the clock, and which are backup for the pediatric neurology residents. And basically, what is important is to have a public awareness and outreach, and empowering the parents as well as the professionals as well as general public. And ongoing medical management and all is very important, and understanding how to collaborate with the NGOs and all, and various organizations. So public awareness is something which is very important. And I don't know why it is just going on and on. Sorry, there's some technical issue. It's just going on without it did not put the animation, but I don't know what has happened. So public awareness and outreach activities. The most important thing what we did for rare disease was last year, the Global Genes had funded us, and we had a series of webinars. We had 20 webinars with 128 panelists from across the globe. And we took out this document. This document has a QR code on the right side, which was in the tweet. And the QR code of all the webinars is also there. So we had, we also had taken out, we wanted to have these people and try to understand what are the barriers and how to achieve financial solutions, and early diagnostic and holistic approach. So if you see the list of topics we had, the early diagnosis and approach for them, and multidisciplinary approach, neuro options, breaking the bad news, transitional care, palliative care, which is not talked about in our country, ethical issues, destigmatization, the humanistic aspect, and the need for research. We involved the ICMR and other government organizations, and then the government of India discussing the rare disease policy and how to have the prohibitive cost. So we had doctors from India and abroad discussing about it, and the medical insurance part, then the parent support groups. Then the role of pharma, we had pharma on board, all the major pharma companies involved with all the rare disease for the DMD and SMA, all of them were on board, and got the media people on along. I got the NGOs and from India and abroad, and whatever the scenario was in the real time, we had professionals from across the globe talking. Then the crowdfunding, we had those crowdfunding platforms, people talking about it, because we have one successful crowdfunding and 1,000 which have not been successful. And self-advocacy, financial solutions through humanitarian access programs, which are temporary means, which are not sustainable. So that is not to be taken as the outcome. It is just a basic starting point only. And the various employee streams and the CSR and all, and also the parenting counseling and coping strategies. We covered all those areas, and I think that's important for all the rare diseases. We had focused only on DMD and SMA in that time. And then the next is you have to empower the practitioners as well as the parents. So we have been developing a lot of, parent information material, which as well as a professional e-learning modules. And we have apps and about for them, for the professionals, and for the parents also, we have many materials. So we are developing SOPs for various neurological diseases, including many, many rare diseases. And for the parents, we have a parents corner in which we have parent information booklets, mostly in English and Hindi, and parent information videos, which are there for them. And they are across various neurological conditions, and they are all bilingual, which are there. And the helpline I mentioned to you about. So that is something which is important. Then, we have been working in collaboration for the research activities, which are there. For the research activities, you have had many projects in which we've done the Atellurine study, and we have also done the Rett syndrome, Sarasitan, and intra-site dexamethasone for ataxatilinjectasia, amongst many other studies. And we have 11 studies with the Center of Excellence and doing a lot of research and collaboration, even like with UCL on working on fires. In that and then are the 5 thrust areas I've already mentioned of our Center of Excellence, and which has 11 projects going on. In addition, we've been trying to tell about 2 or 3 things that we've been trying to say that in out of research that skin biopsy probably can replace muscle biopsy, and because skin biopsy has the erector pylori in the sweat glands. And this we've had 4-5 studies in which we have tried to show, because if you are having all these normal drug therapies which are there, parents may not allow you to do repeated muscle biopsies, but repeated skin biopsies can be there. And we also try to develop from the skin biopsy, we have developed myoblasts, but it's still in the petri dish. And now working on the exosomes right from mesenchymal stem cells. So we've been collaborating with a lot of agencies from India and abroad for the same. And I think this is very important to working with the various organizations, various institutes, as well as non-governmental organizations. This registry, which I mentioned to you, covers so many conditions, and it's just waiting for launch, and it is from 1 month to 18 years. And another thing was I mentioned to you, we are going to keep a follow-up, not a cross-sectional study. Then currently what we are going on, the trials which are going on, before that, we are the medical management for DMD. If you see all the 51, 53, and 45 skipping, the cost is really huge. Cost is really huge, and it is not affordable for our patients. So I really don't know why this screen is going crazy today. I not put animation, but what's happening? So basically, the exon skipping ones are 100 milligram is around $1,000. So that becomes really, really expensive. And even Atellurine is expensive, and nusinersen becomes 4.2 crores for the first year and 2.1 crores thereafter. And we know Zolgensma is 2.1 million US dollars. So we have had all this, which is going on with the help of humanitarian access program. Zolgensma, we have given 18 patients, and 3 were there, out of which 3 were there which were I really don't know why it's moving like that. 3 were there which were not humanitarian access. 1 was crowdfunding, and 2 were given from the, one was given by the Coal India Limited, and another by another power sector thing. And we have had Spinraza 47 patients and Risdiplam 9 patients. All are doing really well, except one Zolgensma had expired because of some issues with the tracheostomy. And regarding other trials, we have this trial of Novartis for intrathecal Zolgensma, and then which is going on. We also for the Eteplirsen trial, which is going on, but both of them recruitment is about to. I mean, the screening is closed, but recruitment is still on. And PTC we have already finished. The study is over. The closeout takes place actually by incidentally tomorrow and day after, with 11 patients who even finished the open label extension part. Ataxatilinjectasia is also completed with 12 patients who were randomized, and the Sarasitan trial, which was there, which we had also randomized 12 patients. So that is also over. So basically there are trials which come up, but Nesnes Pharma came and they started enrolling sites, identifying sites, but then they said they're not coming to India. So I don't know, there are issues with some companies coming to India. We have some more studies with multiple sclerosis and tuberous sclerosis, which are around the corner. But I think which is important is that we need to, I don't know why it's going crazy today. I'm really sorry. I really don't know what's happening to this. We need to build bridges, and that is important because we don't have registry and databases, access to funds and finance, need more research interests which are there, and humanism is not there at all. And we need to have basically I really don't know. But the international collaborations and national networks which have to be formed, which are there, which is important, and precision medicine, which has come up a big way, and a neuro rehabilitation complete form, which has to be there. And together we all can do really well. And we have to move forward together. And I think the most important step is to have collaborations from all sides. And it is not that, as very rightly pointed out in your main document, that you have most of the trials going on in the
Sorry to
US and
interrupt you.
European Union. So I think it's important that we collaborate together. This is the institute where I work, and which is there during the daytime and during our foundation day and during the autism awareness program. I'm really sorry something happened to the slide sharing. I don't know.
Dr. Gulati,
It was
if
just
I
going
may
on.
suggest, if you could exit out of the presentation mode and just
Yeah.
present it directly without going in presentation mode, slide wise.
Okay. Yeah. I can just do that for the last couple of months. Yeah. I don't know why it was going crazy. I'll do that. Yeah. Sorry. I'll just share. I really don't know why it happened. It's never happened. It's the first time it happened, something like that.
So we got
Really
it.
sorry about it. Yeah. Just 1 second. Yeah. It was just moving too fast without, because I have not put any animation actually. 1 second. So it was just going before any speaking. So basically, 1 second. I'll just put on the points which were there. It'll take 2-3 minutes. Yeah, what I've covered, I will not speak. Something which got missed, I'll just say. We talked about the rare disease, fine. We know the Center of Excellence and Nidan Kendras, and I talked about the 5 thrust areas we have. The important thing was having, the public awareness and outreach, empowerment of professionals, and also, sensitizing the general public, as well as involving the ongoing research globally and collaboration with Government of India's NGOs and various internal agencies. And I have mentioned to you about the Global Genes Supported. This was a very important series of webinars which we've had. And I think if you can, I can share the QR code with you. I think I've shared with Nisha. So if that, the document, it was very important to understand how various stakeholders felt about it. And empowering the professionals is very, very important. So we are making a lot of e-learning modules and training programs for them. That is there, and we have apps to help them diagnose. That is for professionals, and very SOPs have been made for many conditions, many of which are rare. And parent empowerment is very important, and that's why we made patient information booklets, and we've been making for the last 10 years. And many of our colleagues who are there from NGOs have translated into regional languages, like our DMD is translated in Telugu, Malayalam, Kannada, and many more. So, they are very important for parents to understand, and we need to empower them. That is something very important. That is what I feel is very much lacking. And this tele-helpline, tele-consultation I mentioned to you about. Then the research activities in collaboration are various, trials for the rare diseases which have been taking place. And this already I mentioned to you about the thrust areas and various projects. This one was something new, which it's been there for last 10 years, but we're trying to, tell this and try to support this, and telling that because if you can integrate a skin biopsy multiple times and have only 2 muscle biopsies, because like even the Sarepta trial we have, so we have only 2 muscle biopsies, one at one point of time, and at the second is at 3 different time points for 3 different sets of patients. So if you have repeatedly skin biopsies and all, and periodically, that will help. And from this also you could get the muscle cells, and also there is exploration of exosomes from mesenchymal stem cells to work, and collaboration is the way forward. And the Center of the Center of Excellence led registry, which is in collaboration with Ghosh, as I mentioned to you, will be something really important, which we've been working a lot. We have worked a lot of man hours over it, and it should be out 3rd December. We are trying to get the first phase of it out. And that will be important because it will also empower the professionals, and because it is going to have the various scales, and some will be mandatory, some will be optional. So you can go into the research mode as well. And also it is going to have, a follow-up. So it will not be cross-sectional. because that is very important. And regarding the online medical management, right now the most two hot topics which are there are DMD and SMA. For the DMD, you have those exon 51, 53, and 45 skipping. All three cost around 100 milligram, cost around $1,000. So for a 30 kg child, all three of them come around 6.8 crores per year for life. And for Atolluren, it comes around 3.4 crores per year for a 30 kg child. And regarding the nusinersen, which is in the first year, because you have 4 loading doses, so it comes around 4.2 crores for the first year and then 2.1 crore for life. And Zolgensma, which comes around 16 to 17 crores, depending on how the dollar moves, is for life. But, if you see, the total cost of Spinraza would be much more than of Zolgensma, because Zolgensma is one time. But the issue with Zolgensma is that you do not know, because it is not the SMN1 is not integrating with the human gene DNA. We do not know for how much time it is going on to produce SMN protein. And it has been shown for up to 5 years, but studies are going on for 15 years to see whether you need to have a repeat dose or whether it's going to work. Risdiplam is the one which was approved, although in August 2020 in the US and by FDA, but in India, this is the only DCGI approved drug which came in July 2021. And right now, the Roche has come with a program for the parents. So roughly, when you see the program, which is Blue Tree, for a 20 kg child, it comes around 72.8 lakhs per annum. So the government has given 50 lakhs for a patient at one time, or over a period of time. So that becomes less. So that is why the central the rare disease the policy through the Central Technical Committee is trying to have a special group collaborating with the pharmaceutical companies to try to see how to negotiate the cost. And other that we are having a lot of we have having from the ICMR and all, lot of driving task forces to try to have indigenous production of various of these drugs and repurposing of drugs, as well as ASO and all, which are being done in many places. Zolgensma and Spinraza and Risdiplam, in the real case scenario, all three have similar kind of outcomes which we have seen. And that is because we are not picking any of them in the first 6 weeks of life. And that can happen only when you're having a screening, because all of them are beyond around 4 to 5 months and beyond. So all of them are having gain in milestones, but not that nearly normal motor milestones as you see in the pre-symptomatic one. But there is a dilemma that once you have a newborn screening, you have to give them treatment. So whether you have to have that kind of a lot of the research has to come up, and a lot of one step has to be moved by all the parties, all the stakeholders, so that we are able to give actually ultimately have a population screening and a newborn screening, and are able to give the medications to them. And being part of international trials, there have been issues, as I mentioned to you, NS Pharma did come and then they did not come. They said that they are not coming to India. There were 2 trials coming up that time. So I don't know, some issues are there with many companies, but yes, Novartis currently, the STEER trial is on, and the Elterelpressin 51 is also on, and Atolluren is over, and the Iridial's ataxia project is over, and Ceredosan is also over. And we are having some ongoing trials for a multiple sclerosis and tuberous sclerosis complex. But I feel that you need to have a compassionate leadership, and you have to have a overall humanistic aspect to it. Everybody should see in the general community, and then only have to improve the workforce diversity, and you have to involve the parents or the self-advocates, however the case may be, into taking the decision making. And you have to have a supporting technological advances, and the support should come from the West. How, with the patent, the cost is so high, I really don't know, but there's some way how the cost can come down for the the countries who have resource restraint like ours. And the role of government, the medical professionals, the NGOs, and the the parents and themselves, and the international collaborations is very important to move forward. That is very important to break the maze for any individual family who is at loss. Yesterday, when I was in the rare epilepsies, and Gabi was mentioning how her journey was there, so I was really shocked to see that so much of lack of concern from other people who are of typically developing parents in the West is also there. there. I thought it was only in our countries, but I mean, it was really, it's much better in the resourced countries where you have a lot of humanism. And you think about India, where there is so much of stigma and there is so much of apathy towards these children. The point is, we don't have a database. If you want to look for patients of one particular kind, you don't know where they are. So that is why one step is to try to make a registry. Right now, you do have an ICMR rare disease registry, which Amlin must have mentioned yesterday, and that is there for few conditions, not for all of them. And it is currently, as of now, cross-sectional, but they are also planning to make it, having a follow-up in that. So it is very important, and the documentations have to be important, and very important for having anybody to have a complete diagnosis in the family, even if the child is some pre-terminal, and the access to funds become more important, and more collaborations during the research becomes important. And humanism in the professionals as well as in the general population as a whole is lacking. And I feel that we have to go, and we have international collaboration to achieve the target, and have some national networks. We have developed a national network from various conditions like SMA, and you need to go forward having the technology and all collaborations which should be there, and try to have a primary prevention by maybe having understanding what are the biomarkers and to prevent the conditions. And the secondary is the early diagnosis, and the ultimate rehabilitation should be there, and coping strategies to be taught to the parents and provide support. And together, everybody has to move one step, so that there is a breaking of the maze for the families of children who are affected with these conditions, and given holistic multidisciplinary management and specific medications. And I first feel also in our country, the multidisciplinary holistic care gets very much missed. People are just chasing the new drugs, but they are forgetting about the multidisciplinary management, and together only we can move forward. And this was, thank you so much, and sorry for this issue about the slide. These were the few thoughts which I had.
Thank you so much for that excellent presentation, Dr. Gulati.
Sorry, I don't know what went wrong with the slideshow. I'm so sorry.
No, it came through just fine. Thank you so much for staying up late. And there are a lot of collaborators here and stakeholders seeking to connect with physicians from India. So we really appreciate you making yourself available and sharing all the wonderful work that's going on there.
Thank you, and thank you for giving me the opportunity. Looking forward for all collaborations. My email ID is my name, which has a double F, and SHEFFALI Gulati, GULATI @gmail.com, which you can share with anybody. We're looking forward for collaborations, and I think it's very important that everybody moves one step ahead, and that's how we want to make a effect in the lives of these children and their families.